I'm going to pass to the Deputy Chair of the Committee, Sir Geoffrey Clifton-Brown, to kick off. Over to you, Sir Geoffrey.
Thank you, Chair. Good afternoon, David. You've had a long session with the Treasury, so we're going to keep this fairly short and brief. In your time in office, when did you first become aware of the possible use of supply finance in the public sector?
Well, Lex Greensill was employed by, I think Jeremy Hayward was responsible for bringing him into government, I think in 2011. I don't think I met him till 2012, by which time he had worked up one initiative, which was two things. It was a mixture of private sector companies that were going to use supply chain finance to ease credit conditions for their suppliers, to help with the credit crunch, which I was all in favour of. And there was this one government scheme to enable NHS pharmacies to be paid more quickly by under supply chain finance rather than by the NHS. So I announced that package in October 2012. I don't think I had any other engagement with the issue while I was in office, but my understanding is that other such schemes and ideas were looked at, but none came to fruition. So I had a relatively limited experience with it, but in terms of the one issue that came forward, I think it was I would describe it as beneficial.
But Lex Greensill didn't suddenly arrive in number 10. Somebody must have briefed you at some stage on supply chain finance. Who was that, and when was it?
Well, I would suspect it would be Jeremy Hayward, and I would have been informed at some stage that this appointment was being made. I don't think I played any part in the run-up to the appointment, but as I understand, the Cabinet Office papers are being looked at, and the Nigel Boardman inquiry will be looking at this, but I'm sure I would have been informed that he was coming in to look at this issue. As I say, then my interaction with him was really around 2012.
So you were asked in the Treasury Select Committee what its use was, what its advantage was it in the public sector, given that there is a public contract regulations, and given that government on a departmental basis pays most of its bills in the high 90% in 30 days and the high 70s in 5 days, what is the necessity or what is the advantage of supply chain finance in the public sector?
I think there are 2 or 3 important points to make about why it has an application, and I think the NHS pharmacy scheme is a good example. And you would have heard in the Treasury Select Committee figures being quoted for it saving the NHS £100 million a year because they're not having to reimburse the cost of capital of NHS pharmacies, and also pharmacies themselves saying how much they liked having the early cash because it eased their cash flow and meant that they weren't having to borrow so much from banks. So I would say, in looking at the public sector, a couple of points. The first thing is, although public bodies say they want to pay their bills early, and huge progress has been made, and a lot of credit needs to go to those organisations, there is in some public bodies just a level of bureaucracy and paperwork that's involved in generating invoices and paying bills. That means there is a delay, and the NHS would be a good example of that. And so using an outside provider who can pay the pharmacies or other small businesses immediately and then reclaim the money from the government, there's an advantage in doing that, because instead of being 5 days, it can be effectively 1 day. That's point one. Second point is, you can use, as we did with NHS pharmacies, actually go one better than paying as soon as an invoice is generated. You can predict what NHS pharmacies are going to be prescribing and pay them in advance, and that's what's happened with the NHS pharmacy scheme. So that's point number 2. Point number 3 is, I think, complicated but important. In his evidence to the Treasury Select Committee, Nick Macpherson said, yes, of course the Treasury is in favour of early payment, but do remember that early payment does mean the Treasury having to produce more cash, borrow more money, and therefore pay an interest charge on it. So there's a cost to the Treasury. And I think the point that Mr. Greensill made in the committee, which I'd repeat, is, of course, if you use an outside supplier of that finance, and you pay your suppliers early, remember you're paying them early but with a discount, they are effectively paying for that early payment rather than the Treasury. So I think those three reasons are good reasons for considering that this is not some sort of bizarre idea, but actually has a real-world application.
So if it's so desirable, why did only one major scheme get off the ground in your time?
That is a very good question, and I don't know the answer to it. I think it would be necessary to ask either Mr. Greensill, who was working in the government at the time, or perhaps some of the Cabinet Office folk who were working with Jeremy Hayward, who very sadly is no longer with us. I think lots of other applications were looked at, but the NHS pharmacy one was a sort of, a really not straightforward, but a really good one, because the benefit was going to these effectively small businesses. But I can't really answer that question.
Isn't the real answer that the Treasury were always pessimistic, even opposed to supply chain finance for the very reasons that you've already laid out, that they've got to pay out the money and pay the interest?
Well, I think well, of course, if you're using supply chain finance, the Treasury aren't paying out the money. That's the whole point. When you use supply chain finance, so for instance, at the moment, the NHS pharmacies are being paid by, well, it was the case before the company went under, they were being paid immediately by Greensill, and the government, the NHS, was paying Greensill back after 30 or 60 days. So it wasn't Treasury money. I think the reluctance in the Treasury sort of relates to 2 points, which are both important points. One is, as Nick McPherson said, if you do pay very early, that means you're borrowing more money and paying an interest charge on it. That's the government paying early. I think that's the first point. And the second point is, they are, I think, nervous about using an outside supplier because, of course, the government's cost of money is lower than anybody else's.
Exactly.
But, of course, the government's cost of money is not always transferred from the Treasury to individual departments. Individual departments' cost of money is a weighted cost rather than necessarily the government cost. So I think there is merit in looking at these schemes. They're not, some people have said it's all totally pointless. I don't accept that. I would say listen to what the pharmacists say. They've enjoyed this scheme and had merit from it.
Thank you very much, Sir Geoffrey.